Hi, I'm Dr. Inglesby.
And I'm Dr. Stephen Cudney.
And in this video, we will discuss the general risks of tooth extraction.
Like any minor surgical procedure, the extraction of a tooth comes with the risks of pain, swelling, bleeding, bruising, infection, shrinking of bone, retained tooth fragments, and damage to adjacent structures such as nerves, other teeth, or a sinus cavity.
Infection is the most common complication after tooth extraction. Rates of infection are low, however, and are generally easily treated with either antibiotics or a surgical washout of the area. In rare cases, infections can spread deep into the bones or surrounding tissues, necessitating a more involved surgery and recovery.
Nerve injury may occur from the surgical procedure itself or delivery of local anesthesia and could result in loss of sensation, numbness, pain, or altered feeling in the face, cheeks, lip, chin, teeth, gums, and tongue. Such conditions may resolve over time, but in rare cases may be permanent. If your anatomy appears to be high risk on a traditional x-ray, a three-dimensional x-ray called a cone beam CT may be requested to evaluate some of these structures further.
Upper teeth in the back can be close to the maxillary sinus, which is a cavity in the upper jaw that sits above the upper teeth. During an upper tooth extraction, and especially if the tooth has a history of infection, it is possible for there to be a hole between where the tooth used to be and this sinus cavity. This occurrence is typically managed with a small dissolvable sponge placed into the socket, additional postoperative instructions, and a scheduled follow-up with a greater than 95% chance of success. In the unlikely case that the opening persists, an additional surgery may be necessary to close the hole.
A dry socket is the premature breakdown of the clot, typically in lower molars, several days after the procedure. Smoking after tooth extraction significantly increases your risk of developing a dry socket. The most common sign of a dry socket is minimal post-surgical pain for the first 4 to 5 days, followed by severe, throbbing pain that radiates to the ear. If this occurs, notify our office as there are options to manage this.
After a tooth is removed, there may be sharp areas of bone around the tooth socket. These will smooth out during the healing process. Rarely, a bone spur will work its way out of the gums, or a sharp area will need to be surgically smoothed at a future appointment in order to allow full healing.
There are some cases where a small portion of a tooth root is intentionally left in the jaw. This can occur when a small piece of tooth fractures, but retrieval of the root tip would do more harm than good, likely because it is near important structures. If a piece of root is intentionally left, we will inform you after surgery, and the majority of the time, the body will heal over the fragment. Very rarely, it may need to be removed at a future appointment.
Jaw fracture is an extremely rare complication of tooth extraction. This very uncommon risk is mostly associated with deeply impacted teeth or teeth that have a large cyst or infection. In patients that are planning on replacing their tooth with a dental implant, we will complete a bone graft in the extraction socket to preserve the bone. Bone grafting is most predictable if completed at the same time as the extraction. In back teeth on the upper jaw, a sinus lift may also be required at the time of implant placement.
Many single tooth extractions are completed under local anesthesia. Sometimes, it is recommended or desired to complete the procedure under IV moderate to deep sedation. This type of anesthesia may cause disorientation, drowsiness, nausea, vomiting, or allergic reactions. As with any anesthetic, whether performed in a hospital or an outpatient setting like this, these risks can be serious and in rare cases may even be fatal. Your IV sedation plan is tailored for your safety based on your needs, desires, health, and age. Some patients may have lingering anesthetic effects, including memory and coordination issues that may uncommonly last for days after surgery. Due to these lingering effects, an escort must accompany you to the office, remain in the office during the surgery, drive you home, and stay with you after surgery until the effects of the anesthesia have worn off. An escort must be a responsible adult that you trust that can assist you if needed. Please be aware that if your escort is not available on the day of surgery, the surgery may be delayed, rescheduled, or completed with local anesthesia alone.